Hello and welcome to the Health System Scenarios, Possible Futures for Health and Health Equity in the USA webinar. My name is Brenna Atnikov. I am a senior consultant with Reos Partners, and today I'm pleased to be joined by members of our Health System Scenario team, Tatiana Willis, Roseanne Haggerty, assuming the internet challenges in the East Coast are resolved, and Carrie Chihak. As we get started, I will introduce you to our panelists, and then next I will provide a brief overview of Reos Partners and our health and equity work around the world, and how we've applied transformative scenarios processes to this challenge. And then we'll discuss the three health system scenarios, give you an overview of them, and then lead into conversation and questions. So our wonderful panelists today, members of the Health System Scenario team, Tatiana Willis. Give us a wave, Tatiana. Nice to see you. Tatiana was born and raised in San Francisco, California, a proud child of its Western edition. She is the inaugural Emerging Arts Fellow at Youth Speaks, and Tatiana is an accomplished writer and singer who has performed at Louise M. Davies Symphony Hall, the Verse Theater, and most recently at the Oracle Arena for Warriors halftime show. She has also studied acting and performing in numerous theatrical productions, including Babylon is Burning, produced by Campo Santo, Po' Boy's Kitchen by Raw Talent, and This Is Home by the Off Page Project, in collaboration with research from the Center for Investigative Reporting. And through her poetry, acting, singing, and activism, Tatiana is known for bringing people to tears one moment and hysterical after the next. And as members of the scenario team know, this is very true and brought just such beautiful poetic wisdom to the scenario team. We're glad to have you on the line.
Thank you.
And Carrie is Chief of Policy for Executive Dow Constantine, the highest ranking elected official of the 13th largest county in the US, where she is responsible for identifying the highest priority policy areas and community outcomes for leadership focus and for developing and launching innovative solutions to issues that are complex, controversial, and cross-sectoral. We just love people who work on things explicitly in a controversial way. She serves as a member of the executive leadership team and cabinet and is a sponsor for the county's Nation Ally recognized work on equity and social justice. Prior to her work in Executive Constantine's administration, Carrie served for 8 years as a senior level policy and budget analyst for the King County Council and as a lead staff for the King County Board of Health. She's trained as a PhD level economist specializing in Japan and served as staff economist on international trade and finance for President Clinton's Council of Economic Advisors. And this year and into next year, she is a fellow of the Center for Advanced Study in the Behavioral Sciences at Stanford University. Thank you, Carrie, for bringing all of your insights and wisdom to the scenario.
Great to be here.
Roseanne Haggerty hopefully will be joining us, and if she does, I'll go into more detail with her bio, but just wanted to let you know that she's the founder and president of Community Solutions, which works to end homelessness and the conditions that create it, and so has lots of experience in the homelessness sector, and she was also a great member of the scenario team. And for those of you who are new to Reos Partners, Reos is an international social enterprise that knows how to make real-world progress. We've been designing and facilitating systemic change projects for 20 years and have built up a rigorous set of transformative methods for addressing complex challenges. Using a pragmatic and creative approach, we partner with governments, corporations, and civil society organizations on humanity's most crucial issues: education, health, food, energy, the environment, development, justice, security, and peace. Again and again, we enable people mired in complexity, confusion, and conflict to work together to construct new realities and a better future. There you have it. That is our panelists. That is about Reos Partners. A little bit more about our multi-stakeholder work on health-related issues. As you've just heard, we are an international social enterprise, and we've worked on scenarios for health. We work on child well-being in several different locations. Lots of work in the last few years around gender-based violence, particularly in Australia, Brazil, and South Africa. There are a webinar that we hosted a few months ago on that can be found online. We've worked on obesity and drug addiction, on mental health issues, increasingly more and more work on health equity, tuberculosis prevention in South Africa, the experience of care with a project called Flip the Clinic, which just wrapped up in the last month or so, and currently working on a project on patient-generated data about how to optimize the use of patient-generated data in the clinical setting with patients. So that is our work on health and health-related issues. You can find out more about our work on other thematic areas on our website, reospartners.com. So as you'll see, we have been using transformative scenario processes to respond to the challenges of health and equity, both in the United States and in other parts of the planet. And the interesting and unique thing about scenarios, as our scenario team members will be able to tell you, is that these are stories about what could happen in the future. It is very specifically not about what will happen. So our work was not about trying to forecast what would happen, nor is it about what should happen. So scenario team members would get the yellow card or the red card when we started talking about what we wanted. Scenarios primarily are about what could happen in order to think about our adaptive and our transformative responses. But first, we must focus on what could happen. And because scenarios are stories and they're fictions about how the future could unfold, they create a space where we can actually have debate and conversation and think about how we might move forward, both individually and together. And so it allows us to we don't have to worry about predicting the future and being correct, but we can think about that future in order to work with it and influence it. When we are working on scenarios and making them for our work, they have to be really useful in order to help us have those conversations about how we adapt and influence, adapt to and influence the future. So scenarios have to meet these 4 criteria. They have to be relevant, so grounded in the current reality of the time we are in order to be able to respond to that time. So we focus on the current circumstances and really think about what are the dominant mental models and the narratives about what is happening, and particularly in this case of health and equity in the United States. Scenarios also need to be challenging, so we often talk about lowering the waterline and seeing more of together what we haven't been able to see. And so our work is to point out what might not be pleasant to point out, and so that we can collectively see things together and have a more comprehensive response. Scenarios also need to be plausible. So for folks that are outside of the scenario team, like the 80 of you on this call, it's about, do these scenarios, do they seem like they could actually happen? Are they fact-based? Are they logical? Are they grounded in the truth? Is it possible that these things happen? And it helps us improve our systemic. And then scenarios must also be clear. They must be distinct from one another to help point out how they are different from one another and accessible and memorable. So hence you'll see that they each have distinct illustrations and colors. I just wanted to take a moment and pause and welcome Roseanne. It looks like you figured out your technical difficulties, so thanks. All right, so in the process of constructing our scenarios, our scenario team of 22 members met over 9 days of meetings. The first set of meetings, which would have been in March of this year, where we set out on our path and we were diverging. So first we focused on the concerns and questions about the future. So what were the burning questions that this scenario team had about how health and equity could unfold in the US? And that led us to thinking about the strategic agenda. So what elements of this problematic situation do the scenarios really need to focus on? And what else did the scenario team need to learn about in order to develop the scenarios that were relevant, challenging, plausible, and clear? As we came to our second meeting in April of this year, we've then focused on understanding the structural driving forces, the key certainties and uncertainties in the space of health and health equity, and beginning to put together what the possible stories were of how the future could unfold. And we also were able to go on several learning journeys out into the system to learn more about what people were doing, and also had a great set of panelists come and speak to us about some of the most relevant and top of mind challenges that people were discussing about how things could unfold, particularly within the domain, the broad domain of the social determinants of health, and really trying to understand how all of these different systemic driving forces within different systems affect people's health. And then finally, in the last workshop, we came together to converge on the 3 most important stories that this team felt needed to be told in order to collectively understand what the future of health and health equity could look like. And so that is where we ended up at the end of June. And then lots of iterating and rewriting and writing and rewriting with Tatiana over several weeks, and then the publishing of the scenarios in September. So the interesting thing and sort of the counterintuitive element of constructing scenarios is that for about 95% of the work, we're doing it because we want to create transformative scenarios that are going to influence the future and help us more in a more comprehensive way work independently and collectively to influence the future we want. But the counterintuitive piece is that in order to do that really well, for 95% of the time that we're in conversation, we never actually get to talk about what we want. We only get to talk about what could happen. And we know that Tatiana was great at holding us to that in the group. So this is the counterintuitive part about transformative scenarios, is we do it to influence the future we want. And we do that by not talking about the future we want. We talk about the future that could happen. And so ultimately, the purpose of the scenarios is to catalyze this open and reflective and generative conversation and thinking that happened within the scenario team, people for the first time, or maybe just in a different way, hearing different scenario or different perspectives on how the future could unfold, and incorporating that thinking into the co-created scenarios that you'll see momentarily. And so we encourage you to also have those kinds of conversations with others, to be in a multi-stakeholder, multi-perspective circle, talking about how these scenarios play out and what that means for you and your work. So here is just a view of this 22-person scenario team, which again we helped convene and support the work, which was supported by the Robert Wood Johnson Foundation. And so big thanks to them. And then we also had learning journeys and resource people, as I mentioned at the second workshop. So these were folks who came in to speak on topics that the scenario team had identified as things that they needed to know more about in order to create scenarios that were even more relevant, challenging, plausible, and clear. And so we encourage you to also check out their websites and what they have to teach you in your work around health and equity. Okay, so great. So now we get to transition into the scenarios themselves, into the health system scenarios. So I'll provide a brief overview of the scenarios. I encourage all of you to download the report and the user guide from Reos's website, where you'll be able to read the full narrative of each scenario if you haven't already, and also guidance for how to use these scenarios in your own work. So as we, as a scenario team, talked about the current reality of what was happening with health and health equity, what we came to understand and came to see through lots of data and conversation was that the US spends $3.2 trillion a year on healthcare, and yet it's one of the least healthy populations on the planet, and particularly within industrialized countries. It has significant disparities in life expectancy and infant mortality, and this is particularly across race and income and geography. And most stakeholders, all of the ones that came and joined the scenario team, other folks that we talked to along the way, agree that the current situation is unsustainable and that change is necessary. What the scenarios do is reveal the different pathways forward for how to address the challenge And we may disagree on the ways to do that, but we all agree that at the very least, the current reality of health and inequity is no longer sustainable. And so the three scenarios that we'll summarize now are the different ways that achieving health or health equity might unfold. So the first one is marketplace, in which change is driven by politicians, consumers, and companies who are concerned about excessive government regulation. So in marketplace, there is an ever-growing focus and attention on the role of the marketplace to resolve and respond to the issues of health and equity. That is the key strategy for a response. In conference room, change is driven by governments and employers and other powerful stakeholders who are concerned about the high economic costs of illness. And so the response here is regulation and legislation and policy grounded within what we know through the social determinants of health research to respond to health challenges. And in kitchen table, it's driven by activists and marginalized and vulnerable communities who are concerned about inequity. And so the response to achieving health and health equity is one based in grassroots activism and multi-sector collaborations at the local level. So if we go to the comparative table, when working on scenarios, you'll get used to seeing these comparative tables and how they change. And what is helpful about seeing the scenarios in this table is this is particularly how we can see how the scenarios are distinct from one another. And so in marketplace, the federal government changes its regulatory and funding role, and essentially the federal government reduces its function as a regulator of healthcare markets and cuts spending on public health insurance programs. Large employers, as a result, alter how they provide healthcare insurance to their employees, as well as small and medium-sized businesses have increased restrictions as to what healthcare benefits they provide for their employees. And as a result, use of community benefit hospitals increases, particularly on the part of those who are uninsured and underinsured. But health products and services thrive for those with purchasing power. So that's how we see the story unfolding for marketplace, so that by 2030, wealthy people are getting healthier, and people who are living on low income and without health insurance are ill more often and unable to get out of debt. There are pockets of innovation that lead to advancements in healthcare, but these cannot be scaled beyond those with purchasing power. And as a result, health inequities continue to rise in the United States. So according to the scenario team, responding to the challenge of health and inequity and changing the access to health is primarily driven by the marketplace. But according to the scenario team, as a result, what actually ends up happening is health inequities grow in the United States. In the story of conference room, the high cost of illness is seen as a drag on the economy and the economic competitiveness of the country, and particularly its preventable chronic illnesses that are a drag on the economy, keeping employees out of work. And as a result, large employers demand new rules and regulations to drive down costs. And over time, they realize that just regulating the healthcare markets alone is not enough, but actually it's needing to get to the root causes of why people are not healthy. And so a demand that policy and rules and regulations are based on evidence from the social determinants of health. And then over time, public and environmental health crises add to the pressure for holistic solutions. And so we see things like lead poisoning and increasing cancer rates and opioid addictions continuing to be a drag on the economy, as well as affecting people's health and life. And as a result, over the years, by 2030, there's comprehensive health legislation, which finally passes. And as a result, in 2030, what we see is a complex set of federal regulations and legislation, which is designed to incentivize decisions and behaviors that promote holistic health. And some new laws and regulations are successfully implemented and show signs of reducing healthcare costs. And you've got professionals constantly working on improving and refining these policies. And finally, the story of kitchen table, which is government action and inaction leads to civil unrest and grassroots activism. Activists experiment with different social change approaches, including protests and online campaigns and storytelling events. Grassroots groups grow into local and national service providing initiatives. So you've got these multi-sector collaboratives who are working at the local and national level to provide health and policy change. And community organizing produces mixed results across the country. So where activism and the economic conditions are good, change happens. In places where it is harder to organize and get the economic resources that are required, it's harder. And so as a result, by 2030, health outcomes improve in places where activism and financial resources are strong, and in other places, health inequity continues to increase. So those are our 3 scenarios. And now what I'd like to do for the next few minutes is have a conversation with the panelists, and then please start sending in your questions, and we will be happy to respond to those. So the first question I wanted to ask, and I'm going to direct this over to you, Carrie, is, yeah, what do you, now that you've had all these, we had many days of workshops together and some time now since the scenarios have been published to think about them, what do you see now that you didn't see before as a result of working on these scenarios?
Well, I think as a result of our time together, I really see much more opportunity for cross-sector partnerships. So to borrow a phrase from Manuel Pastor, there's a lot of uncommon common ground available here. And that really came to me through the work that we did on the conference room scenario, where you know, it's not just individual communities and social groups that are worried about health inequity, but there's really a case to be made by the business sector that we really need to invest in a different way to improve people's health and reduce the inequities that we see. So that really stood out for me, that we can bring community, the business sector, labor, the health sector, public health, so many different sectors together to address health inequity in the United States.
Great. Roseanne or Tatiana, anything else to add in terms of what you see now that you didn't see before as a result of working on these scenarios?
I think that I for sure pay a little bit more attention to the policy aspect of it. And I think I always look at them through the lens of the scenarios that we created and where they could fit, and seeing if, like, you know, we missed anything. You know, if I like see something that we didn't include, I'm like, how can we have it incorporated? So I think that that's something different now that we have created these scenarios, is that I have these 3 lenses in which to look at, you know, the healthcare system.
I'll just add how powerful the scenario planning process was, and the discipline of moving beyond ideology and the desire to see a certain outcome, to wrestle with the complexity of multiple viewpoints, and just to frankly embrace how messy any of these scenarios would be to implement, but to across many perspectives realize that, as Carrie and Tatiana both stated, the conference room approach is equally plausible with the others and would involve less damage, more gain, and serves as a rallying point, I believe, for what a desired future could be. So I would just like to shout out the value of this process for working through very fraught and contested issues.
So on that note, Roseanne, maybe I'll ask you the next question, which is, when you think about the set of scenarios and all of the insights that they surfaced for you, what has been the most significant actionable insight something that you're doing now that you may not have been doing as a result of the scenario process?
I think, and just to go to actual practice and the influence of participation in this process, the need to work with unusual suspects, to understand that the place to start is probably conversation, that employers and insurers, in addition to activists and people working in kind of a delivery of health environment, need to be in conversation, and that listening and conversation is proving more effective than I would have imagined in surfacing areas of potential collaboration.
Carrie, I see you nodding. What other, for you, actionable insights have been raised from this process?
Yeah, well, I want to concur with Roseanne about just the power of the process that we went through. I found that the structure that really drove us to create these clear scenarios was really valuable, and having that combined with techniques that really allowed us to listen to each other across many, many different viewpoints was valuable, and I think something that we can drive into the work that we're doing in King County, working with many different partners. So in that regard, what we're doing in King County, a couple of things. So I think the scenarios to me pointed to our need to invest even more greatly in the ability of communities to organize themselves and to have their voice be at the table and influence what we're doing in the government sector. In addition, we've had a table that we've called the Health Enrollment Leadership Circle, which is a big cross-sector set of actors: business, labor, health sector, government sector, our city partners, libraries, community organizations. And we put that together around getting as many people enrolled as possible in the expansion of Medicaid in Washington State and in Obamacare. But what we've realized, I think in part, coming out of these scenarios, is the power that group can play as we move forward in trying to move toward a future that creates better health equity.
Great. Okay. When you think about, and maybe Tatiana, I'll direct this to you first, and then if Rosanna and Carrie would like to jump in, but we talked a lot about how the scenarios help us see the future as it is emerging in front of us, and even began to send messages to one another of, as different pieces of news emerge, we'd say, oh, this is conference room, or this is marketplace. So I'm curious, and this is part of the function of scenarios, right? That they help us just see that future a little bit more clearly, and then be able to respond to and influence it more quickly. So Tatiana, I'm curious, in the last few months, as after the scenarios have been published, what snippets from the future are you seeing? As you say, you pay attention to things a little bit differently now. What are you seeing happening in the United States that you may not have seen before? And what are those snippets from the future that catch your attention?
I think I'm actually able to look at the things that are happening within healthcare objectively and not just emotionally. And I think that one thing I recognized in doing the transformative scenarios was that I was basing everything on like, oh, this is bad or this is good, and how that mind frame could really stop you from being able to see the potential and things. So like thinking about we talked a lot about the opioid epidemic, and I just recently saw a tweet that said, in 2016, more people died from drug overdose than in the wars that we've had. And, you think about that and you're like, wow, what scenario, how are people affected by it? How is their life being transformed about it? And, just thinking about it's just interesting in everyday life. And although I know this is all about the scenarios that we created, the kitchen table and conference room and marketplace, but really that all three can exist at the exact same time. And that there's different things from each one happening at the same time. And just that ability to be able to say, this isn't the future that I want, or this is moving in a way that I don't want it, but that this is, I don't know, it's like chess and checkers, you just can see the moves happening. And when you take off the emotional blindset, then you can prepare for those steps. So that's what I see a lot, is that people are saying, okay, this is probably what the next move is. How do we stop that from happening?
Great.
Yeah, I can jump in here too. I think, watching the efforts of the Republicans in Congress to repeal and replace Obamacare, it's that movement is certainly driven by the conditions that we identified in the marketplace scenario. And I think as a result of that, we also are seeing a lot of community activism against some of those efforts. So that has elements of the kitchen table in it. And at the same time, you also have some pretty interesting coalitions from the business community coming together to say, no, we really want to see a different future as well. So, and that's obviously kind of, a conference room piece. So, all of what's happening right now around policy work at the federal level on healthcare, you can really kind of see these different, the different scenarios playing out through that, which has been pretty fascinating.
Roseanne, anything to add?
No, just to echo both Tatiana and Carrie, just seeing something like the emergence of the Alexander Murray proposal. It just seems like very much like there is room in ways that perhaps we wouldn't have imagined before we started this process to see these unexpected possibilities in the direction of the conference room. And just as I think at the end, very encouraging that things are not scripted. We can, see new alliances form and work to influence more collaboration in unusual places.
Great. Okay, so we're gonna begin to answer some questions from the other folks on the line. So just a reminder to those of you who have questions, please send those to us in the Q&A box at the bottom of your Zoom screen. And the panelists will be happy to respond. So please send those in. One of the first questions we've got is from Tammy. And she asks, who are the stakeholders in Kitchen Table, and who are the targets of grassroots organizers, and what are they trying to change? It seems that policymakers have a critical role in this scenario, since there needs to be a national paradigm shift in order for health to be considered a right or a public good and not just a commodity. So how does this scenario account for this? Anyone like to respond to that?
I'll jump in. I think the thing for me about Kitchen Table, and other people in the scenario team may have a little bit different perspective on it, but for me, the Kitchen Table is a scenario that really emerges where the federal government just, doesn't take any further action. And so in that scenario, you really have different communities coming together, organizing themselves to try to create actions that lead to better health equity. And we see some of that happening already. So for example, in my state, Washington State, we have a Medicaid waiver, and the state has helped us to create what we call accountable communities of health in each region of Washington. And in those regions, we're really working to try to define a different kind of future for health and health equity, taking a much broader perspective, not just healthcare, but really looking at the social determinants of health. I think one of the dangers of the kitchen table scenario is that, you know, as Brenna sort of explained about the scenario, we may end up with better health equity in certain regions, but there may be regions of the country that get completely left behind. So if there are places of the country where it's really difficult for different sectors to come together, or for communities to be able to organize themselves. And I think that's particularly true in places that are dealing with some of the worst health problems in the country, like some of the areas of the country where the opioid epidemic is really playing out in some of the very worst ways. It may be difficult for those communities to organize themselves. And then that's going to create inequities by regions across the United States, even while some are doing a little bit better.
Right, and maybe I'll add, because something that really stood out for me working on this scenario was the very localism approach to it. So in the question, Tammy talks about the national paradigm shift that's required in order for health to be considered a right. And what was interesting to me about this scenario was that it was very based in local work and local activists changing the paradigm, not at the national level, at least to start, but much more focused on local communities and counties and municipalities. And one of the examples that we drew from was work talking about how in the climate change community, when the federal government and when the presidential administration removed itself from the Paris Accord, the reason that 50 mayors were able to respond the next day by saying we're going to still be committed to the Paris Accord was because of the local effort to be doing that work regardless of what was happening at the national level. And so we saw that was a plausible dynamic to play out in the health and health equity space as well. That it would be much more focused at the local level and not as much being a requirement based on what the federal government decided. Okay, another question is, how do you start looking at using health system scenarios for your workplace when you don't have a background with analyzing or looking at them? So I'm happy to take that from a methodology point of view, but would be curious to hear more from each of you, your experience of how you're using the scenarios in your workplaces as a tangible example. Roseanne, do you want to take this one as a start? It might be connectivity issues. Oh yeah, we've got Roseanne.
I'm back. Sorry, unstable connection here. This is the question about if you don't have a background in healthcare.
Or if you don't have a background in actually creating the scenarios, how do you go about using them? And so be curious just to hear your experiences of using the framework that the scenarios provide to approach your work in new and different ways.
I think two key ingredients without having had any experience in scenario planning are very straightforward and kind of easily transferred. One is this notion of just surfacing ideas about the future without any judgment, you know, just around this framework of, is it realistic? Is it challenging? Is it plausible? Is it clear? And then the kinds of techniques that we practiced around deep conversation with others who are coming from different perspectives. The one-on-one walks, different exchanges. Those are tools that they seem simple, but they're surprisingly powerful for opening up kind of a new space for conversation that's beyond ideology.
Tatiana?
I think one thing that's helpful outside of just the scenarios is actually the book. I think the book is extremely helpful in trying to figure out how to look at the frameworks when you're thinking about the scenarios, and really understanding how we arrived to the scenarios, I think is very helpful in, because I mean, analyzing sounds very difficult, but the truth is that unlearning, you know, right and wrong, and what you want and what you love and what you hate, you know, really are blinders. So I think that more than anything, unlearning those things is really helpful when trying to think about how to implement the health system scenarios for your workplace. Because I'm an artist, so my workplace is very different than a lot of the people that were on the scenario team. And so for me, what I really tried to bring back was actually the transformative scenario planning process. And so I think that might be helpful if you're having a hard time just trying to use the scenarios, that maybe actually, like, you know, getting the book, reading the book, and really understanding the process could be extremely helpful.
Great, thanks, Tatiana. And just because we had a quick question about it, so the book that Tatiana is referring to is the book called Transformative Scenario Planning by my colleague Adam Kahane, and we'll send links to that. Carrie, you're on mute.
Say that I'd also say I'd also encourage people to look at the book that was produced around the health system scenarios, because that in and of itself has a lot of tools. You know, after the scenarios are described, there's a set of tools that you can use for conversations in your community, whether that's your workplace or your set of friends or your school. So please do take a look at the health system scenarios book.
Thanks, Carrie. Another question is, or maybe what I'll add to that just before we move on to the next one, is from a methodology point of view and how to use the scenario. So as Carrie said, there's a user guide at the back of the health system scenarios report. And so there's guidance on how to use it both for individual reflection. So maybe you're not working day to day in a place like Tatiana, where you're not necessarily working day to day on health related challenges, and yet your work is somehow connected to the social determinants of health. If you're a large employer, if you're a medium-sized employer, if you're a journalist, if you're an artist, that in some way what you're doing does have influence on the health of individuals and communities. There's questions in there that you can use to reflect and think about how you either adapt to the scenario or how you try to influence the scenarios. And there's also suggestions of how to apply the scenarios in a education setting, and also strategic planning processes within your organizations. And you know, what was interesting to me too about the process overall is sometimes we don't judge the success of the scenarios on whether we got them right, whether we predicted the future correctly, because that isn't what we were trying to do. But it's about how the success of the scenarios is how relevant, challenging, plausible, and clear they are, and therefore useful for being able to influence the future that we want, and or sometimes it's actually the most important scenario, if you will, is the one that we manage to avoid. It helps us see into the future more quickly, and therefore be able to prevent that future from unfolding. So just the next question is, do you always work to develop 3 scenarios, or do you ever explore more or less, and what is the beauty of 3? So again, from a methodology point of view, we often talk about the ideal set of scenarios being either 2, 3, or 4. And in the book that Tatiana mentioned, Transformative Scenario Planning, you'll see that there is either an inductive approach or a deductive approach to scenarios. So the deductive approach often ends up in a matrix where you look at the two most important or most significant driving forces, and then the scenarios emerge in those 4 quadrants. And this scenario team, we worked from an inductive point of view, and so that is how we ended up with 3. But yeah, you could end up with 2, 3, or 4. Anything less than that, it would be a prediction if you were working with just one scenario. Anything more than that, it just gets, there's just too many stories and they may not be distinct and clear enough from one another. So the next question that has come in is, what was the second key factor for creating scenarios that was mentioned in the last question? So that might be the 4 criteria that makes scenarios useful, which is relevant, challenging, plausible, and clear. And that will when we send out the slides, you'll have more information on that. And if I didn't answer that question well, feel free to clarify and we'll come back to it. So with the next few minutes we've got before we end the webinar, here's a question from Teresa. How do you combine scenarios that bridge political and financial power with scenarios that bring the power of the lived experiences? Who would like to respond? I can jump in as well. But.
With that question, it makes me think about kitchen table, because the drivers in that scenario are the folks, are the people, are the human beings, not, and they're trying to drive, one, they're trying to heal their own community within themselves, and that can inspire or drive the political and financial power. Because if, any group of color chooses to not financially engage with capitalism for a quarter, it's going to have some impact, and people are going to look at that and think, what do I need to do? It's the reason why, when a Dove commercial that comes out that seems racist and folks are like, I'm not patronizing this business anymore, they come out with an apology, because that's the power of lived experience. That's the power of folks using their voices to advocate for themselves and advocate for the things that they deem necessary for their community. So I think that's the kitchen table really tried to combine the power of lived experience, inspiring political and financial powers that be.
Thanks, Tatiana. Anything to add, Roseanne or Carrie?
Certainly the kitchen table, as Tatiana said, is the place where the lived experience issues were especially elevated. But I think also we saw in part of the messiness, but the potential of the conference table was that somehow market forces and community forces would be in some type of essential conversation.
Great. Carrie. You're on mute, Carrie. There you go.
I'd also just say, even though the scenarios are distinct, I don't see them as mutually exclusive in terms of how the future evolves. So you can certainly imagine a situation where the federal government moves to sort of pull out of healthcare provision and regulation that creates a lot of community activism, like we're seeing some of that happening now. And then from that community activism, there comes a point where community and other sectors like the business sector actually work together on a conference room style proposal. So the scenarios may kind of play out over time in a way that sort of moves among those scenarios. And again, I think there's a great opportunity for that kind of uncommon common ground where lived experience and economic and other kinds of power come together in a way that creates a new sort of future.
Great, thanks, Carrie. And I think that responds to another question we've had, which is around, how do we think about the scenarios distinctly, but how do we also see them as a set of scenarios working together? And I think all three discussed and shared. It's really about, we don't anticipate the future unfolding in only one of these pathways. In fact, they're likely going to unfold to different degrees and in different amounts in different places of the country. The trick is that those scenarios really help us see the dynamics of the scenarios playing out maybe before others might, and so we can more quickly respond to and influence how that future unfolds. Okay, we've got time for one last question, and it's a question around the social determinants of health. So as this project with the Robert Wood Johnson Foundation kicked off about a year and a half ago, this was a core framework that we thought through in terms of thinking about health being beyond the health system, about all of the dynamics that are at play that bring about individual and community health and illness. And one of the questions was, do we need to think beyond the social determinants of health? Is the social determinants of health actually a more deficit-based model? And might something like asset-based community development be more useful in our thinking? I'm just curious, in the last few minutes we've got, your thoughts on that.
I agree that I think the social determinants of health don't really tell the full story and context of why things are the way that they are. And I think we tried to move beyond just social determinants of health, but there's this, when you are asked to come up with scenarios for the future, you recognize what some of the difficulties that some of these policymakers have, which is you can't include everything all the time. And so, so yes, I do, and we talked about the sick care system, and even moving from that language of recognizing that this is not a health care system, that this is an sick care system. So yes, in short, we can move out of that, but that has some difficulties to it.
I think we let language get in our way a lot. I mean, I think if you talk to the average person on the street about social determinants of health, they wouldn't really know what you were talking about. But if you talk to them about the importance of housing and transportation and education and work training and all of those kinds of things, they, of course, immediately understand. And so it may be not that we need to get beyond the quote unquote social determinants of health, but I think we do need to recognize that part of the social determinants of health are really people's ability to feel like they have power and authority and influence over their own communities and their own lives. So definitely, taking an asset-based approach, I think, is really important in all of this work.
Any closing comments from you, Roseanne?
Only to echo Tatiana and Carrie, and one of the virtues of this experience, and I think sort of getting beyond our passions about these issues, was also about not letting language trap us, and to find those places where there's violent agreement, and around wanting as many people to thrive as possible. So just really very much appreciated this way of organizing, thinking about a very complex issue, and just to commend the whole book to those who are interested in the topic. The detail is very important in terms of illustrating the inclusiveness, I think, of the process.
Great. So on that note, we'll begin to wrap up and maybe with a quick response to the final question, which is around how to stimulate conversation about making the best of each happen and avoiding the pitfalls of each scenario. And that's where you'll find guidance in the user guide around taking both how you have conversations around an adaptive approach to the scenario. So if these unfold the way they unfold, and we don't intervene in any particular way, we just have to react to how these scenarios unfold. What would we do? And if we want to actually influence the future and take a more transformative orientation to the scenarios, what might we stop doing and start doing and keep doing in order to influence those futures to unfold the way we want? So I encourage you all to turn your attention to the user guide and find a way to use it in your organizations, in your communities, in your homes, and to be in touch with me if you have any questions about how to do that. And you can reach us at healthequity@reospartners.com. So just a quick note of thanks again to you, Tassiana, Roseanne, and Carrie. It was just a joy to have you on the call today and a joy to be part of the scenario team with you. Thanks for sharing your insights with us. Many thanks to all of you for joining us. It was great to have so many people on the line and sharing great questions. In a few days, you'll receive an email from us with a recording of this webinar and and links to the materials that we refer to, particularly my colleague Adam's book, and the link to the site or the page on the Reos website where you can download the report. We welcome your feedback, so feel free to email me and let me know your thoughts, reflections, observations, and to let us know how we did on this webinar. If you want to learn more about Reos's work, please go to our website, reospartners.com, and you can sign up for our quarterly newsletter there. And yeah, thanks again, everyone. Have a great day. And if you have other questions about how to use the scenarios, that's the most important part, is their use, please do let us know.